Hello and welcome. I'm Patrick Curtis, your host and chief monkey, and this is the Wall Street Oasis podcast. Join me as I talk to some of the community's most successful and inspirational members to gain valuable insight into different career paths and life in general. Let's get to it. In this episode, Boston MD shares his path of 11 years of schooling to get his medical degree to breaking into a top consulting firm. Learn why he pivoted away from medicine and some of the opportunities afforded to graduate students trying to break into strategy consulting. We also hear what has been the most difficult part of his transition to work and one wise piece of advice he gives to the younger listeners. Enjoy. All right, Boston MD, thanks so much for joining the Wall Street Oasis podcast.
My pleasure.
So first off, love the username. If you could obviously, I'm a huge Boston fan. If you could give the listeners a little summary of your bio, that would be great.
Yeah, definitely. So born and raised in the state of Kentucky, ended up deciding to kind of leave the state just to have an opportunity to kind of find myself, explore new territories and meet new people. So I ended up going to a school in Atlanta, Georgia. Most of my time was spent as a pre-med. So I was a biology and neuroscience major, really with the ultimate goal of trying to get into med school. So that's really all I focused on. Did some scientific research during the summer at various institutions across the country to make myself a little bit more appealing to the med school process. After I graduated, I decided actually to take a year off. Went up to Baltimore, spent a full year in the lab, getting published, really trying to kind of perfect my resume to the best of my ability. And then decided to kind of matriculate to med school.
Nice. And go ahead.
Yeah, so applied to med school, got a number of different offers, applied as an MD as well as an MD PhD. Wasn't really sure what kind of track I was most interested in going into long term. Really liked my institution at Duke. Just really liked the people there, felt home. Really felt I could grow the most there. And so I decided to enroll there. Within the first couple of months, really thought I was going to be a general surgeon. That's what I was kind of training to do. Had talked with a number of residents and professors in that space, and really felt like my personality fit, my interest in surgery was genuine, and thought that was going to be my track. So about halfway through my training program, I decided to pursue a second degree. So I decided to pursue a master's of clinical research that kind of focused on health economics and outcomes research. And so as a part of that, really got exposed to the business side of healthcare. And so learn more about payer and provider dynamics, value-based care models, a little bit more about the journey of pharmaceutical drugs and devices from preclinical stage to market products, and really started to enjoy that more than I thought I would. And as I kind of explored that more, talked to some of my mentors, administrators within the university, decided that was going to be the path I would choose, at least for a couple of years before starting residency. And so I thought management consulting sounded like an interesting path. And so I did kind of normal route in terms of applying to, McKinsey, Bain, BCG, some kind of smaller healthcare focused firms, and really thought that LEK offered me what I was looking for. They kind of guaranteed that I could do life science and healthcare 24/7, 365, which was, of course, most appealing to me as a medically trained physician. And then didn't have to do as much traveling.
Great. And
as
so,
well. Yeah.
So let's go all the way back it sounds like you were very focused on medicine, even up through medical school. And then suddenly you had this kind of change of heart or change of pace. What do you think drove that? Was it you weren't enjoying the medical aspect as much, or do you feel like something else was calling you?
Yeah, very good question. No, I actually really enjoyed the medical and clinical aspect of my training. I got a lot of enjoyment out of it, really liked the patient interaction, thought I was doing some really interesting work, making a difference in patients' lives. Um, but I think it was just the opportunity to explore something that I wasn't familiar with.
Hmm.
And I knew it was at a time where the Affordable Care Act was going through a number of revisions. The healthcare industry as a whole was trying to find a better way to provide care more efficiently and more affordably. And I thought that was something I wanted to better understand. Whether or not I was going to stay on that path or even come back to medicine, I thought that training and that exposure would make me a better clinician,
So you kind
and a
of
better.
it sounds like it was like a curiosity thing where you were just kind of
Exactly.
you didn't want to you didn't want to just go do medicine for your whole life and just never having
Exactly.
done anything else. Okay, so
That's
you
exactly right.
experienced that, but you enjoyed it, right?
I did. I enjoyed it a lot more than I thought I would actually.
What
Uh,
about that? Like, what about that? It kind of piqued your interest. What specifically was it? The clinical research part of it? Was it the like what?
yeah, it was more about learning about healthcare policy and healthcare economics, because that's not something that med school really trains you to understand. It's about how to diagnose someone and how to treat them, and that's really about it. And so, understanding some of the economic underpinnings of some of the decisions that academic medical centers make, private teams and professionals make when they're trying to do their own private practice,
Yep.
or even larger healthcare systems make. I think it was about really trying to kind of round out my understanding of medicine and healthcare.
So being a now, I guess you're now a consultant, right? But you're really a
I am.
specialist. You're kind of a
Yep.
specialist in the under consulting, right?
Right.
So in terms of what you do day to day, is it what we would typically think as like a management consultant where you have actual clients and you're helping them solve problems, or are you are you put on engagements? Obviously, they're focused on life sciences and healthcare, I assume. But how do I even think about? Let me step back. Easier question. How do I even think about life science consulting? What do you do?
Yeah, so basically what I do, I focus specifically on strategy and due diligence cases. And so within the life sciences, we're talking about biopharma companies, large, small startups, what have you.
Hmm.
Also looking at medical technology and devices
Hmm.
companies. And then we also have another component that's healthcare services, so payer, provider, value-based care models, et cetera.
And so, how much of
And
your work is like doing research about like the actual market financially and business wise versus like bringing your medical knowledge and your clinical health,
Yeah,
your aspect?
definitely. So I'm basically used as a management consultant that you would be at any other firm. So I have client engagements that I'm on.
Hmm.
And essentially, what makes me different is that I have this clinical component that kind of allows me to serve almost as an expert to the team. And so within the life sciences, we all know it's really technical, a lot of terms and jargon that unless you're kind of raised in that space, it's kind of hard to understand, and you can kind of get lost in the fray. And so to have someone who can kind of ramp up quicker, who can serve as kind of that expert on the team and kind of give more validity to the work product for the client, I think that's kind of where the value add that I bring
And so,
is. And
are
so
you placed on like more engagements than like the typical like person 1 or 2 years into their their role because you're like hitting on almost all of their life science stuff, or are you brought in only on specific ones where like your expertise is the most important?
yeah, so I'm brought on any case. I'm open to be brought on any case that revolves around healthcare and the life sciences,
Okay,
and so it doesn't have to be within a specific niche aspect of that. It can
got it.
be any related case.
Okay. And so how's that
Yeah,
been? I mean, you were in school for a long time.
yeah,
And then,
yeah,
from what, 2007 to 2018, 11 years you were in
yeah,
school.
yeah,
And then
yeah.
finally you're in the working world. Talk to me a little bit about that transition. What is
Yeah, definitely. No, time flies when you're having fun. No, it was a difficult transition. I'll be honest. It coming into consulting was like learning a new language.
Yep.
I had a very limited business background,
Mhm.
learning how to do Excel modeling, learning what a valuation of a company is, learning
PowerPoint.
about PowerPoint, all the dynamics behind that, which were all very new to me.
Were you
Um,
when you were prepping for your interviews, like you said you did the McKinsey Bain BCG thing, how were you
yep,
coming out of med school? Do they recruit out of there? I think they do have something for PhDs, but were you
they,
recruiting, do they have something for MDs?
they do, yeah. So basically, we were recruited similar to how PhD other graduate students are.
Hmm.
And so my university had a consulting club
Hmm.
for graduate students, so advanced degree consulting club. And so basically, we would have, either former or alumni of the university who are now at these firms come back and just trying to recruit, tell us about their experience.
Did they help you prep case
They
interviews?
did, yep, and they definitely did.
They even
So
give
I
that to
would
you
bug
guys,
them.
huh? They even
Yeah,
torture you.
yeah, exactly. So did that. There was case competitions that the club kind of hosted. So did all those kind of typical things. Would work with people on the
I assume it
weekend.
was super competitive given how sharp all the MDs are and the PhDs, and like
Yep.
they probably pick it up
Yeah.
really fast, right? And then
Surprisingly quickly. Yeah. Yeah. Definitely. And so, we would find time to Skype or meet on campus to do, fit interview, question practice, as well as practice cases that we would get from the business school and bug all the business students for. And we
so
really just, yeah.
are you planning, is this move for you like again just more of like a taste to before you go into practice? Do you feel like you're going to end up going to residency in a few years, or how does that, or you, is it like more of a matching process where like you don't know what's going to happen? Like how does that work in terms of like you have to get recommendations out of med school for like different
Yeah.
residencies, or is it?
Yeah. Yep. That's right. And so, the way I had kind of lined things up for myself was that I would do all the necessary things to get into residency so
Mhm.
that, if that time came and I decided to make that transition,
Yeah.
I would have all the test scores, recommendations, etc., ready to apply. And so I had that lined up, and I told myself each year I would reevaluate and see, do I really enjoy what I'm doing? Am I over it? I want to go back to medicine. And I figured within the first 2 or 3 years, I'd have a clear understanding of kind of what I want to do and what I'm enjoying and whether or not I want to
But
go back
you're
into
not there
practice.
yet. You don't really know yet. You're kind of
I
still
think,
evaluating.
well, I think at this point, I kind of know that I'm going to stay kind of in the business side of healthcare and kind of give
Okay.
up, becoming a practicing clinician.
Oh, wow. Okay, cool. So, in terms of the specifics, we can go back to the kind of recruiting aspect of things. So,
Yeah,
alumni were coming
definitely.
back, giving you that, helping you with case interviews. What was the hardest part of going from medical knowledge to case interview knowledge?
Yeah, I had no idea what a case interview was.
Hmm.
And so trying to just read any book I possibly could on, a case in point and all those kind of typical interview preparation books just to learn what a case interview was.
Yeah, we
How do
have one
you,
on Wall Street Oasis management
yes.
consulting firm, actually. Yeah.
So just wanted to do all of that. So it was about just trying to read, talk with alumni, get a sense of like what a case interview was, how do you prepare for it, what does it look like to do one well, what kind of questions are usually asked, what is the thought process, how do you break
What do you
down a
think? What do you think was the biggest impact out of all that prep?
um, being able to effectively communicate a complex problem, break it down into its smaller pieces, and evaluate each piece one by one to get
But
to an answer.
what practice led to that?
Oh,
Was it
yeah,
just repetition,
it
brute
was.
force?
Yeah, yeah, that's exactly right. And so
Yeah.
I probably went through 30 to 40 practice case interviews, with, other PhDs and uh, alumni and
Bet
even
your yeah,
MBA
and I bet your 30th was much
students.
better than your first.
No doubt about it. No doubt about it.
Cool, man. So, So yeah, in terms of just advice you'd give to your younger self, you went through a lot of schooling, or any other the users that are that are maybe in medicine, that are considering a career in consulting or business or finance. What
Yeah.
would you say in terms of how to evaluate it?
Yeah, I would first say to always, be open and true to yourself in terms of what do you like, what don't you like, and just be open to exploring different avenues. Because I think kind of going through the pre-med track, getting into med school, you kind of have to have blinders on. That's all you can really think about. That's all you can really do. It's all about, doing as well as you can in classes, get as much research experience, score as high as you can on the MCAT, and you can't think about any other option. And so, trying to take a step back, always kind of be willing to explore new things, whether it's educationally related or personally related or kind of what have you, and
Mhm.
and be open to see where that leads you.
Yeah, it's an interesting point. I mean, I think there's probably a lot of listeners that have parents that are pushing them to be doctors
Yeah,
or lawyers
definitely.
or engineers, because I know we have a lot of listeners that are from Asian descent, Indian and Asian American, and even people from Hong Kong. And the stereotype is their parents tend to push them into one of three careers, and
Yeah,
I see it here, and I always say, don't rush into something. And I think that the 1 year you took as a break, was it not a break, but when you kind of went to the lab,
right.
my guess is that was probably like, well, let me just see what this is like. And you kind of were started exploring outside of medicine, probably because you're curious. And I think that's
Yeah,
important for people to feel comfortable doing that and know that they have a lot of time.
yeah.
You don't need to rush through everything.
No, you
People
do.
go to
Yeah.
medical school when they're older.
Yeah, and no doubt about it. I had people in my class, some of the most brilliant individuals I've ever interacted with. One came from law school,
Mhm.
and now is an MD/JD, and so not only practices medicine but does malpractice law, and can kind of meld the two.
Yeah.
Another individual was an actor out in LA, had done that for a little bit, and decided, that radiology was more of a calling, and so came to med school and now they're radiologists. And so again, it goes
But yeah,
back to be
my cousin um, didn't go to med school till like 4 or 5 years, or even more, after she graduated undergrad. So some people take a
yeah,
while to kind of get there,
definitely.
and there's nothing wrong with that. And I think it's important to kind of, when you're ready to do it, it's a huge commitment. Obviously, I mean, you went almost straight out of college. You had that 1 year, right?
Right. That's right.
But it was pretty
It was a
intense.
grind. Yeah, it's definitely a grind, no doubt
It
about
looks
it.
intense just looking at your LinkedIn. I'm like, oh man.
Yeah.
um, but yeah, I mean, kudos to you for pulling it off, and having the courage to kind of do something else after all that. So yeah, anything else you want to share before we call it, or anything you think that's useful? I think what you said was great, but figured I'd ask someone last time.
Oh, I mean, I think for individuals like myself who um, were the first to, go to graduate school of any kind, the first to become a doctor.
Hmm.
A lot of people kind of feel that pressure to, do something great for their family and for their legacy. But also know that, do it for yourself as well, and not always trying to put too much pressure on you if your parents expect you to go one way or another, but,
Yeah,
say
you
it
got
for
to do it.
yourself and
Yeah, you got to do it for yourself. I mean, you're the one
yeah,
that's going to be waking up every day,
so-
going to that career,
exactly.
that job.
Yeah, living that life. Exactly.
It's your life. Make your decision. Figure out what you like, not what your parents want you to do. Because guess what? They're gonna love you. They may disown you for 6 months or a year, but if you're waking up happy and you're positive and you're successful because you're doing what you love, I think there's a lot to be said for that.
No, I completely agree.
Great. Well, Boston MD, thanks so much for joining us.
My pleasure. Thanks for having me.
And thanks to you, my listeners at Wall Street Oasis. If you have any suggestions whatsoever, please don't hesitate to send them my way, Patrick at wallstreetoasis.com. And until next time.